Folks, thanks for coming on the line with us today. My name's John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing the situation that insurance agents and the Medicare beneficiaries and the folks that advise them across the country are seeing with some of the changes brought about by the Medicare Plan Finder. We'll speak to that situation and then discuss some of the options that you have as contracted agents with Premier and the Integrity platform to help you with this situation. And I think you'll be very happy with how things will roll out for you. As a bit of a housekeeping note, today's presentation, along with several pieces of information that we'll allude to through the course of the presentation, will be sent to everyone who has responded to today's webinar, and it will include a link to the recording of today's presentation. So that said, we'll spend that time talking about the CMS Plan Finder and alternatives that we have in place for you. A bit of level set for those of you who may not be familiar with Premier Marketing. We are a national marketing organization founded in 1968. We're part of the Integrity marketing platform with offices across the country, and we act as an insurance wholesaler working with independent insurance agents, providing services to the Medicare community through contracts with multiple carriers across the country. Those contracts are available at the highest possible commission levels. They're vested, and there are recruiting contracts available for those who qualify. As I mentioned, we were founded in 1968, so that means this past year we celebrated a milestone in our history, our 50th anniversary. We feel that's quite an accomplishment for what began as a small family agency in rural Nebraska that's grown into one of the largest producers of Medicare product in both the Medicare Supplement and Medicare Advantage space. We do so through a full portfolio of insurance programs, including Medicare Advantage and Medicare Supplement plans, standalone prescription drug programs, a full portfolio of life insurance and annuity, and that includes final expense and pre-need programs as well. Additionally, long-term care and short-term care programs are available for you, along with disability income and ancillary programs that include dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes all the national carriers and many of the strong regional carriers that can make a difference for you in your market. That same philosophy carries over into the standalone Part B prescription drug plan area, where the national carriers are available to you through our organization. That Medicare Supplement portfolio is very broad, very robust, and we also supply different marketing programs to help you be successful in that space as well. Ancillary products, those name carriers are there for you in each of those categories, and these companies are very innovative in their support and the delivery of their products. When we look at the Medicare arena, we are looking at an area that anytime you come on a call like this, somebody like me is going to stand up and say, hey, you got a person turning 65 every 8 seconds, 10,000 a day. It's a huge market. Well, if you look at the Medicare market based just on age, as many of you are aware, that's not a true indicator of the size of the market. Many of the folks that turn 65 nowadays are working past the age of 65 and not accessing full Medicare benefits until later in their life. And there is about a sixth of the Medicare population that doesn't show up on this chart based on age because they access Medicare benefits because of disability. So we have a very large and robust market that's a bit varied, and it has some challenges that we need a varied portfolio and tools to deliver that portfolio because of what's happening to the Medicare beneficiary's body. There are a ton of different chronic conditions that come into play, and sometimes their income and savings are impaired as well. So having different programs that can help address a person's particular situation, personalize the benefit package, and make it the best fit possible for that individual can really make the difference. Hence the need for electronic systems and other programs that can help us identify that best fit plan. Because folks have different options as they come into Medicare, and they have different programs then that address those particular choices and the means we have to make that process simple for them to add additional coverage. If someone stays on original Medicare and picks up a Medigap policy, it helps to have programs then that can help sift through the multitude of programs that are out there and available and make it the best fit for that individual. If they pick up a prescription drug program, obviously there are very few of us who know drug formularies across the board. I'll wager to say no one. So we need that type of tool to help us identify drug coverage if a person stays on original Medicare and picks up a Med Supp or self-insures, which is an option, and picks up drug coverage on a standalone basis. When we look at the Medicare Advantage alternatives that are available, we also need tools that help us sort through not only the medical benefits, but the drug benefits that are embedded in those programs many times. And so, hence the conversation that we hear a lot right now about some of the changes on the CMS's medicare.gov website. As folks are aging into Medicare, we're seeing a near even split between Medicare Advantage and Med Supp programs. And you have a portion of the folks out there that choose to stay with original Medicare only. That may be because they have retirement coverage, or they may choose just to self-insure. However, if we have the information available to deliver options to this population, we may see some additional movement in that area. So why is there all this chatter going on right now about Medicare and the tools they make available? Well, for the first time in a decade, they're changing the system. When you go to medicare.gov and you check out the different options that people have through the system that's made available, we're seeing a not market change, but there are some significant differences in what's been available to us as agents and advisors in the past and what we see moving forward. What we have is a new Medicare Plan Finder. It operates a bit differently, and it is powered by a different software system than what we've seen in the past. So if you want additional information specifically, having some challenges here, with the training that was delivered by CMS back in August, we have that for you, and we can get that for you to you as well as part of the follow-up to today's presentation. If you want to go through it in its entirety, but keep in mind it's 104 slides. If we send you the PowerPoint, we won't get it to you. It won't fit through the servers. The PDF is about, well, it shows you right there, 5.6 gig. It's a big comprehensive program. I sat on actually one of the presentations they gave. There were two of them. And it was very interesting how some of the changes come about and how they've been publicized. What you're seeing is a bit of pushback from different advocacy groups on how the system was set up in the old fashion, and many of the advocacy groups are still not too terribly happy about how the system is set up moving forward. During the month of September, we have access to both the old and the new system. After the end of September, the old system will sunset, and with it, much of the information that we have stored in that facility as advocates for our prospects and our clients. What the CMS says, well, this redesigned Plan Finder is supposed to make it easier for beneficiaries to see changes when you're comparing prices between original Medicare, Medicare prescription drug plans, MA plans, and Med Supp programs. The challenge that you have in that particular circumstance is, according to the gentleman who gave the presentation from CMS in August, they don't have really the information on particulars from the Medicare Supplement programs and they don't really have a way of getting it either. So what you have right off the bat is a bit of a misnomer in that description that came in that previous publicity piece from CMS that you saw a slide earlier, where Medigap plans aren't accurately compared in the system, either the old system or the new system. It does, however, allow a greater friendliness to different mobile devices. So smartphones and tablets are accessing the system cleaner than the old way. It does allow up to 3 plan comparisons, either the drug plans or the MA programs, which you see can be very helpful. And as we get into some of the cost differential, you'll see why you actually really need that. And then, of course, it does lay out the different plan costs and benefits, which Medicare Advantage plans offer in addition to traditional Medicare coverage. And it allows an individual to build a personal drug list and find the coverage that perhaps best meets their needs. Some little bit of pushback on all of that, because what the challenges that we have is the program itself offers different alternatives in which to compare the programs. The option that most of us that worked with the system in the past realized that, well, it's gone. And that's the option that offered the total lowest annual out-of-pocket cost. So that total cost calculator is missing from the redesigned plan finder. There's a move about for them to remedy that situation and get it done. Pardon me. But are they going to be able to do it? We don't know. The options that are available in the new system include sorting those Plan D results based on the lowest yearly drug deductible, based on the lowest drug cost, and based on the lowest monthly premium. We see there that that doesn't give us a true indicator of which plan might be the least expensive for an individual. So it does, in this circumstance, require a little bit of math on our part, where we sort by the lowest drug cost and then add that total to the monthly premium to give the total cost of that program. Sounds simple and clear as mud, doesn't it? Well, one of the challenges that we have with it as well is for the folks that are actually doing their homework before they access their Medicare benefits, those folks that are approaching age 65 or getting ready to retire, if they don't have a Medicare number, the new MIB number, they have some challenges because they can't establish the account within the system that enables them to save their information. Where in the past we had an option where the system would save the drugs that were inputted, well, it's not there anymore. In order to do that, you have to set up an individual account for the individual by the individual, and hence then the prescriptions that would be inputted in the system would be saved. Any of the data that's in the old system, the legacy system that has been in place, it won't carry over to the new system as it transitions through. I apologize. I'm having new systems in my computer and it's kicking up some interference for us. So part of the challenge that we have here is the folks also have some difficulty using the system to find a key indicator, a differentiator between programs, and that's the provider network data on the programs. Either they're not available within the tool, and that gives you some challenges because obviously that's a key indicator as to what might be a person's best fit for a plan. It always is a strong indicator of a choice for an individual, and we find generally that most people, well, the plan isn't just about the premium of the program or the overall cost of the plan. It deals with some of the providers that come as part of a network-based program. So you have concerns as well where some people feel that the way the program is set up moving forward could potentially compromise privacy. And they point out that many of the folks that would like to access the program, the older or perhaps poorer Medicare beneficiaries, may not have access to a computer and would need help creating those online accounts. So one of the things that we have found as well is the current system does clearly identify the different requirements that are made necessary by the plan regarding referrals and authorization requirements. Different little symbols that are in the system currently. Those systems will disappear. You'll find that basically the details on health programs are available only one plan at a time. So the plan comparison doesn't list all the benefits. And in order to check the details of a particular program, you got to basically either print the pages or flip back and forth, which is a challenge either way. You also need to click on limit supply next to a particular service to see if that requires a referral or advanced plan approval. That means you have to be pretty adept in a system and be patient enough to click through all of the programs you need in order to access the information that you're actually looking for. And it also doesn't clearly indicate that some of the challenges you have for PPO plans in the new version. These will have a bearing on the folks that are willing to look at a managed care program as long as they have an option to go outside that network, and hence there's a bit of a limitation there too. But here's one of the things that we see as agents that makes the biggest difference to us. No more drug ID list. So in the old program, in the legacy program, it enabled us to basically just write down an ID list, and we could go back in and access it in the future for the folks. And so in essence, you were using medicare.gov to store the drug information and do so in a system that you could access that information then again in the future to further update or do a year-over-year review. That option's kind of going away there for you. And CMS, during their presentation, said in order to actually work around this situation to a degree and create an account, well, you basically have HIPAA concerns as a advocate on behalf of the individual. So the person has to create their own account. So if you're in their house, here's my computer, we're on medicare.gov, I'm going to turn it over to you. You can enter your username and password. Or if you're talking to them on the phone, you can enter it in, but you're not supposed to write it down. I'm pausing dramatically there because you realize the situation that brings about, and some of the things that might come into play because of the PHI that is involved in the situation. So one of the things that you will see is that when a person creates a new account, you are going to have drugs that are imported into that person's account, but it's based on the medications that were billed to Medicare. It may not necessarily be a current list of medications. So moving forward with the plans, even if a person has established an account and lends you access to it during your conversation, the medications in there will have to be double checked anyway. So something to consider. So as we look at how we are going to deal with this situation moving forward, it's important for us to be open-minded and see what else is available for us to use in order to help folks make a solid decision as to what plan might well be the best fit for them. So let's look at some of these options, because even the legacy plan finder, with some of its shortcomings and some of the things that we miss, well, it's not a true sales tool anyway. It doesn't really hold all the information that we need to use it as part of a CRM system. It doesn't actually give us some of the information we need to properly communicate with our folks, because we've got to have a listing of who actually is that plan number, even if we had it in the past. So let's look at some of the different systems that are out there and our options for us to use moving forward. And keep in mind, because of some of the limitations you have between plan types, between Medicare Advantage, PDP programs, and prescription drug programs, you may need more than one system to make it work. And part of it depends upon the area of the Medicare world that you focus upon. So if we were to look at a needs or a wish list, we'd want a system that would be easy to access and use. We want to make certain, most certainly, that it is compliant. It's able to compare all the available coverages that are out there. It's able to import information from different files that are out there, both based on the plan types and the medications and the formularies and everything that comes into play there, but also perhaps even our book of business. It's also flexible enough that it can change the different parameters that help us identify the proper program. And it's able then to make certain that the plan types are what best fits our beneficiaries' circumstances. It also would allow us to have the beneficiary do some of the research on their own, which many folks are doing now ahead of time. That would enable us to help make certain that we answered the questions that they had and that they would be able to proceed a little bit along the decision process on their own, which many of the younger folks want to do. We'd also want the system to be able to store all this information, the personal information, compliantly within the system, and we'd obviously want it to be a tool we could use to enroll electronically and hence save time and effort across the board. Because what's our most valuable resource? Our time. There's a few people in the world that realize that I don't want to work every weekend and I want to sleep a little bit, and every now and then, hey, I like to have a snack. It's called a meal. So you've got a limited amount of hours in order for you to best approach your market, and how do you best spend them? Well, some of the things that we've seen from indications that are given to us by Deft Research, Connecture itself, different tools that are out there that give us different demographics, what we see and was demonstrated in a webinar by Connecture this past week are there are a couple of different approaches we need to take based on who we're marketing to. The younger folks, the folks that are just aging in, are a little more comfortable with electronic systems. They like to be independent on their choices, but they want to have information to help with the confusing options they have. So they want a little guidance, and they want to make certain that they have the detail that's necessary to help them feel that they've made the right choice. They want it to be a respectful process and have the system work cleanly enough where the medical experience is similar than what they've experienced in the past. So they're going to look to keep providers. They're going to worry about drug costs. They want the right coverage at the right cost. So you want a system that's able to access networks, drug information, past and current, and make certain that it gives a evaluation process to do so. The older population doesn't do as much shopping on their own, but they're more educated as to how their current plan works. So they want someone else to help them a bit. They will chat with other individuals. So perhaps this is a group that would respond a little more to seminar selling. And these are folks that actually do shop and will consider switching. And those switching choices have been influenced by how they access information online and do the research. One of the biggest indicators of what makes a person make a choice is not only total cost, but also the medications that come into play and how they can help deal with certain costs that are discriminatory. What do I mean by that? Well, maybe they have choices between different physicians as part of their network, or therapeutic alternatives when it comes to their medications. not just a name brand versus generic difference, but also different drug types, should there not be, or different drugs within a type, if a person has a particular name brand medication that they're looking for alternatives for. So this is a different type of shopping experience, and we see that it affects sometimes the choices that they make between a Medicare Advantage and a Med Supp program. One of the things they look for the most from us as agents is a system that would deliver a comparison of benefits between the programs that are available for them. And this is one of the things that we then refer back to keep the open mind. There are a number of agents out there that, hey, I'm an MA agent. I sell Medicare Advantage programs. I don't know why anybody would ever pay a premium when they got coverage for free. And then you have some folks that say, hey, I don't know why anybody would ever take a plan that would limit who they could see when it comes to the care that's being delivered. We need to look beyond some of our own personal bias in that particular situation and lay through some of the other information that makes a choice solid for the individual with whom we're speaking. Because part of it is, if it's a network program, well, your outlook about a network surely changes quite a bit if you think of the fact that, hey, my doc's in the network. I don't have to worry about that. That's not as big of a concern. I have a means then to also compare prices on the different programs, that lays them out, and it gives then the verification as to the choices that are in there and the different alternatives that come to care, particularly when it comes to medications. So you'll also find that these folks are, hey, it's halfway through September. New plans don't come out until the 1st of October. You can market for those first 15 days. You can't sell anything until the 15th. But you find a lot of the folks have actually shopped throughout the year, and a good chunk of them are doing some heavy shopping right at the first of AEP. So you want a system that's able to deliver these pieces of information quickly and accurately, and then allow those plan comparisons, give a quick quote, and upload all the documents that are necessary to keep that process compliant. Find the best fit, show the impact of the drug cost, and enroll. Because people now look beyond the premium, they look at some other factors. And so one of the things that comes into play for us as agents is how fast can we make this work? If you have a system that's doing a lot of the shopping for you, obviously it can cut down the comparison time, but it also delivers the information that our prospects and clients need in order to make a decision. And so that delivery speeds up their decision time as well. And we realize as agents that many times an individual doesn't always agree to a change on the first appointment. If we can minimize the number of folks that have that need to, hey, I want to think about it, or have a system that allows us to access that individual again in the future, enroll them remotely without having to have a second appointment, it can make a huge difference as to, once again, that Salvador Dali melting clock and the time that's so precious for us. It can also help us keep the folks we already have in our book of business. Delivering this information makes then the persistency of our book much stronger. One of the things we see as well is a big emphasis by the beneficiaries that the medications are such a huge part of the decision. Having a system that allows us to input that information, store it, and do a comparison year over year, that really helps with the personalization of the process, and helps the person make that decision much more cleanly and easily. I remember when the medication programs first came about, when Part D rolled out, I used to do different group presentations and offer a analysis of the drugs that an individual is taking and the plans that might be most effective for them. The challenge is that takes a little bit of time. Once it's in the system, however, if there is a system that will store it and give us the opportunity to look at different alternatives, you set yourself up for the future. And it gives us then a service that folks are actually looking for. That leads us to alternative number one. Finally, John, 30 minutes of talking about the other. Well, part of what we wanted to do was demonstrate some of the challenges we have with the Medicare Plan Finder if it's the old version or the new one. It doesn't do everything we need as an agent. Medicare Center, the platform that is available through Premier and its platform partners, does address many of those issues. One of the things it does most certainly is streamline your Medicare sales. So you have a way of delivering information, a way of enrolling an individual remotely for those folks that, hey, they just don't want to meet face-to-face. There are folks that have challenges in setting an appointment, be it at their home or a safe third location or at your office. And then there are the folks that will procrastinate. You have also Mother Nature and some of her fury. That is a real factor when it comes to the latter part of open enrollment. When you get into December, sometimes you can't drive in the snow and the ice. Sometimes you can't drive far enough and fast enough to make it work too. And that time you spend on the road with some of the additional regulations and good common sense about talking on the phone or texting or everything else that you do when you drive, you want to minimize that windshield time. This system allows you to do just that. It allows you to compare multiple plans side by side compliantly. It enables you to deliver that information to the beneficiary so they have it ahead of time. You're doing so electronically, and you're able to do so with both Medicare Advantage and prescription drug programs. It also enables you to collect a very important piece of information that's necessary for that presentation to be compliant, and that's the scope of appointment. You can also use that same system to collect the enrollments. It also gives you the opportunity to store that scope of appointment, because keep in mind that scope of appointment, you're supposed to keep that on file for 10 years for everybody you met, not just the ones you sold. And by doing so within this system, you're setting up people who may choose this year to go with a program with someone else, something you don't offer, but it gives you the opportunity then to go back to them in the future. You set up a bit of a pipeline year over year. These electronic comparisons are delivered by the system, and as long as you have electronic access to your clients and prospects, it enables you to deliver that compliantly and quickly. It can also act as a CRM with detailed information within the system to help you year over year. One of the challenges that we have in many circumstances is not just leads, but then how do we handle the leads moving forward? By creating profiles within the system and utilizing the business toolkit within it, you're able to not only track an enrollment process, but also keep all the information that is necessary to make a quick decision. You're able then to deliver those quotes and increase the conversions that you have with the people that you speak with. It also totally addresses the challenge that we have with the Medicare Plan Finder, past and future, where you can enter and safely save the drug lists that are a crucial part of a decision-making process for the folks you visit with. So it's going to enable you to drive up your persistency with year-over-year reviews. It'll enable you to access the folks who bought from you and who didn't, so you have a strong prospect pool. And you can also use it throughout the year as part of a cross-selling process. By having that information within the system, it enables you to go back to your book of business or to folks that bought a different program, as long as you have that permission to contact, and visit with them about additional products. You understand generally what happens when you have multiple policies in a house. Your persistency for all those policies go up, and the likelihood of that individual being not just a policyholder but a client greatly increases. So some of the specific tools within the system include the Plan Compare piece, which is the Medicare decision-based tool that allows people to look at the different options they have available, personalize them, and see what the total cost of ownership estimates are for their situation. It also enables you to take offline enrollments via mobile devices, tablets, reduce paper applications. I understand there are many folks out there that haven't quite kicked the paper addiction, but utilizing an electronic system for an application really streamlines the process for you once you're accustomed to it, but it also really speeds up the process for the carriers that you deal with. They like those much better. It's a cleaner process, a quicker process. It's the applications process much more quickly, and you get paid more quickly in the regular selling season as well. I kind of hedge on that when it comes to AEP because we realize that we don't get paid until after the first of the year on many of those programs by the effective date. What the system also does is it allows a broker-specific URL. What the heck does that mean? Well, basically, it's setting up a link that you use that anyone who accesses a plan choice through your link, you're credited for that application. And it is a compliant system. It can be used to actually access the need to complete the email signatures. It gives you the delivery of the different marketing materials that's necessary. And once a person utilizes that, it notifies you that the process is being completed and submitted. A big piece of this, where a big advantage of this moving forward is, of course, the Drug Compare program, where it enables your folks to manage their drug cost by looking at perhaps equivalent dose therapeutic alternatives, a nice long way of saying, well, is there a better drug within that drug type than the one I'm using for my situation that I can then discuss with my doctor to make certain that it works as well. Also then, which plan has the different medications and how do those costs affect my overall out-of-pocket expenditure throughout the end of the year. It also does a formulary lookup where these formularies are updated on a regular basis because a plan can change a formulary throughout the year. If a drug's taken off the market, obviously they're going to take it off. If it becomes available as a generic throughout the year, well, you know what's going to happen there. So you have the opportunity for folks to make certain that the medications remain on program. Not only that, because it doesn't change that much, but different carriers not only include a medication on a formulary, but there may be differences between the tiers in which that medication is covered. So you have the opportunity then to make certain that a medication one plan offers as a tier 1 drug versus a tier 3 drug with another program. That's a huge difference, many circumstances, when it comes to out-of-pocket cost. It also gives you the opportunity to look up if there's a preferred pharmacy and if it's the one they use, because that can affect the overall cost as well. And generally, different pharmacies across the board as to who is available in that network. You also have an opportunity here, which was one of the points of contention with some of the advocacy groups with the Medicare Plan Finder, of accessing providers. So you have the opportunity here to work through a situation with the system to find if the providers are in or out of network. Some of the things this enables you to do now is you can preload different data within the system, and it can help with having those analyses perhaps available for you ahead of time. So if you have information from individuals from in the past, you can, oh, pardon me. have that system set up and ready to roll ahead of time. Pardon me, my systems are dancing here. It also gives you the opportunity that if you have visited with a person in the past, they have the material to help them with their decision process, it enables you to send out a short enrollment form. So it gives you the chance to look at enrolling an individual into the plan that you discussed in the past where they said, I have to think about it. A great way to do that remotely and accurately moving forward. It also then maintains that information for you within the system year over year. So a bit of a synopsis, it gives you the opportunity to focus on the consumer experience. So they have a personalized guide through the system. It helps you be a bit of a prescription expert, giving you alternatives within the system and the information as it applies to the different plans being considered. It also helps us in our business practice because it enables us to be efficient. Not everyone is going to be comfortable enrolling online. This, however, gives us the opportunity, this tool, to store their information and help them with that process for them and do so compliantly. And as I mentioned numerous times already, it gives you the extra opportunity to drive up your persistency and retain your business. What's it going to cost you? It doesn't. For the programs that you contract with through Premier and their platform partners, this program is available to you without cost. Does that mean that every carrier in the world is in this system? Unlike the Medicare Plan Finder, no. It's the systems and the carriers with whom we contract and are available in the system. So generally, when you use the Medicare Plan Finder, you didn't contract with every program in that system either, and you led to your default systems in many circumstances. What's the best alternative you have to offer to your prospects and clients? This parallels that experience. But what if you're one of those folks that, hey, I don't do as much in the Medicare Advantage world, I'm more of a Med Supp agent. How then can I make an electronic process available through those programs? Well, one of the first things that I would do, obviously, is still set up the profile in Medicare Center with the medications and everything else that comes into play, even if you're not looking to sell it, because circumstances might change for those individuals in the future. But having that information about drug coverage and then working through the medical options they have available can make a huge difference. And that is available through another tool we make available to our agents through the Medicare Supplement, or pardon me, the CSG quote engine. By accessing this system, you have a multitude of different products within this program that enables you to quote Medicare supplements across the board. It then allows you also to utilize a tool to visit with the folks that have a Medicare Advantage program already in place, don't want to change, or quite happy with their decision, but want to address some of the shortfalls within that program. It enables you to kind of fill in the holes then, basically, with the system. It also has an e-app function for many of the Med Supps that are in the system, and gives you the opportunity to quote and deliver ancillary product, including final expense, hospital indemnity programs, which is your shortfall in many of the Medicare Advantage programs, and additional dental coverage, which I don't care what your basic medical coverage is. For folks who want dental coverage, there's never enough in any of them, even if you have a Medicare Advantage program that offers dental coverage. A new addition to this system, and something that will help many folks when they, well, I'm a Med Supp guy, but I sell a little bit of PDP. It now has an e-version of the scope of appointment document available for your use as well, and a means to store it here too. So you can stay compliant within the situation. And many folks are discovering that delivering that scope of appointment basically ahead of time sets up additional conversations about other products. We've got some other trainings that we go through and walk you through a way of addressing that. So you can use the e-apps for the med supps within this system. Check out the applications as part of the quoting process, and I'm going to send you a link to a training that addresses this specifically as part of the follow-up, and it allows you to collect that scope, and there is another tutorial on that as well for the specific process. That will come to you as part of the follow-up as well, and the storage of that document. So there may be other circumstances where, hey, I don't do a whole lot of contracting with multiple carriers. I have a carrier that does some wonderful things for me all on their own in the med sup world with their e-app process. Hey, I only sell for 2 MA carriers. They have an e-app process as well. Why would I want to do this instead of utilize that system? Remember that storage capacity. Remember the opportunity to act as a CRM. Remember the year-over-year opportunities you have with a system designed to give you that information. But that will give you some opportunities to have information about a one-off on a different carrier as well. So we have that information available for you. So while we've described the program and why you want to use it, we haven't really gone into the nuts and bolts of how Medicare Center or the quote engine piece does satisfy your needs on a one-off. We have that information available to you. We actually have an upcoming presentation on how to use Medicare Center as to, okay, I'm going to get in, here's the keys, I'm going to start the car and drive it. How's it work? This is the webinar for that. You will get additional information on how to access this as part of the follow-up to today's presentation as well. What you have, in addition to some of the information we've talked about, if you're dealing with people on a virtual basis, an electronic basis, sometimes it's helpful if they have the accessibility to it to hold virtual meetings. So consider some of the tools that are out there without cost, joinme.com, or a number of different pieces where you can do a bit of a face-to-face electronically and still use electronic systems, cut your drive time, and deliver a compliant presentation and an enrollment process through the use of these virtual meetings as well. And you have the opportunity to create different images of yourself and deliver a follow-up process that helps people stay on the books. Because remember, boy, things can change. We do offer you also an opportunity to put your social media marketing efforts on autopilot through our Coverage Made Easy program. So this gives you the opportunity to get in front of people to deliver upon those electronic systems moving forward. Some other things that you will get as part of an association with Premier, well, you have an opportunity to access discounted errors and admissions coverage. There are a ton of carriers out there, very few agents. Put them all with one organization. Very few organizations have every carrier. What you need, however, is E&O coverage that will cover you regardless of whom you contract through. This program does that for you, and it allows you protection as a true independent agent. We also help you with your licensing to keep it up to date, discounted continuing education programs through our association with WebCE, a way for you to also add to your own personal benefit package through non-cancelable DI programs on a modified guarantee issue basis where you share in the commissions on DI on yourself. And much as where today's presentation is being recorded, there are a number of other programs that have been presented in the past, are recorded as well, and it gives you the opportunity to go back and revisit some of them or look at different options that you may have missed in the past. And you'll see those listed both on our website and on our YouTube channel. When you have multiple programs available as well, you want to make certain that you are not only best serving your prospects and clients, but you are receiving all the compensation to which you are due. And so you have an opportunity here to see all the additional incentives that are available by many of the programs and how many of those will apply to our own Premier Producers Convention, which next year is a cruise from Miami to the Bahamas. In order to get in front of these people with all these wonderful systems, though, you got to have some way to create a lead flow. We talked yesterday on a webinar about direct mail. We have other programs available for you as well, contact lists that are available at low or no cost, depending upon your contracting situation, a way to walk through and address community-based mail marketing programs. There's a lot of movement right now on Walmart's. That selection system, for the most part, is fully delivered upon, but there are some recent communications from Walmart where someone who had taken a store and not able to deliver on it moving forward, there may be one-offs in certain markets that we can help you with. We also have systems that help you market through centers of influence in your community, including faith-based organizations, and through the people that deliver the care that you're insuring through different providers. Some of those providers, particularly in the Medicare Advantage world, may have different leads they've generated. Some of them are what I call a Lazarus lead, where you get it after its third shot, but it's a way to access the public through the carriers with whom you work. That's a symbiotic relationship, so those are generally delivered by companies that you're writing with now. We do have a Facebook program for internet leads and other internet options, and we do help support your direct mail program on a production-based discounted program where you get help with the cost of a mailing based on your production. All that said and done, we've gone through 50 minutes of options that you have available with accessing the enrollment processes for your prospects and clients. A couple of different ways to do it. We deliver on these systems because we want your business. What you need to do is decide if this is a key part of your marketing plan moving forward. I don't quite see how any agents who deliver in the Medicare space programs to their prospects and clients that don't need some sort of a tool to help them make that situation as clear as possible and the process as clean as possible. The systems we have in place can help you do just that. Additional information on how those systems work when it comes to a nut and bolts situation will come to you as part of the presentation today as well. So all that said, keep in mind today's presentation and much of the information to which it alludes will come to you as follow-up, but you can reach us through our toll-free number at 1-800-365-8208. Your Premier Marketing associate will be there for you and the questions that you have and how you can make this tool work for you. These tools, I should say, work for you. You can also access information through our website. I'm going to check for some questions. What, logistically speaking, might adversely occur if we move a client from an MAPD to an MA only? Oh, pardon me, my system's frozen here. Well, if you're going to take a person from an MA plan to an MA only program, they better have other prescription coverage that's creditable, because if you enroll someone in a MA plan that has a network-based chassis, they're opting out of their drug coverage. So something to consider there. I have 10 years of client drug list embedded in the Medicare website. Can we protest the CMS before this valuable RX info is lost forever? Can we export from Medicare's website with this information? I hate to be the deliverer of bad news, but unfortunately, there's not a process to export that information, and it will be lost as one system moves to another. One of the things that you'll see between the legacy system and the new one moving forward is there's a different vendor that powers it. Prior vendor's information is held by that vendor. By the way, that's the vendor that actually delivers on Medicare Center. The new one moving forward with the blue button system, it's not going to be there. That's part of the challenge that you have with dealing with the government, of course, as well. But you're not going to be able to export that information and deliver upon that. One of the other questions is, how do we access this system that you've discussed? Well, the Medicare Center program, you are automatically, as a contracted agent with Premier or its platform partners, if you're certified and ready to sell, you have access to the system. You need to basically go to the website for that system. I'll have that information in the follow-up to today's presentation, the web link. Create your account, just basically your username and password, and your detail will be in that system. For the plans that you have contracted with us, it's there and it'll be ready to go as long as you are ready to go. Let's see here. Challenge that someone has here with the Medicare website for the PDPs. Once again, it's kind of you're going to start over, plain and simple, because that information will not be available once that old system sunsets at the end of September. I appreciate the direction on the right arrow. Whereas Connect-A-Care, that's a system available in one state. The entire listing of the carriers that we have available through this system will actually be sent to you as part of the follow-up, and new carriers, additional carriers are being added to the system as we go. I'll look you square in the computer here, Don, and tell you, is Connect-A-Care on the system? I don't know at this point in time. Sorry, sometimes deliverance of ignorance, well, it's confirmation of ignorance, I guess. So that said, watch for the follow-up to today's presentation. We thank you for the investment of the time that you've made with us today. We need to discuss the usage of this system and some of the things you can be doing now in order to ensure sales when the marketing and sales system seasons open in AEP. There are things that you can use this system for now to set up a good process for that by having that information already inputted into the system, profiles created for your prospects and clients, and have it work. Okay, that said, thank you all. We look forward to visiting with you in the very near future. And in the meantime, we wish you good selling. Thanks so much.